Welcome to Learn with Livanta, Medicare, the BFCC-QIO, and you. Livanta's podcast where we bring you up-to-date information about QIO services and the overall Medicare landscape. Livanta holds a contract with the Centers for Medicare and Medicaid Services as a BFCC-QIO, or Beneficiary and Family-Centered Care Quality Improvement Organization. BFCC-QIOs are contractors hired by Medicare to make sure that Medicare beneficiaries receive the care they deserve. All Medicare beneficiaries have a right to high-quality health care, and BFCC-QIOs like Livanta protect that right. There are three primary services that we at Livanta provide at no cost to Medicare beneficiaries. 1. Medical record review when a beneficiary wants to appeal their discharge from a hospital or the termination of Medicare-covered services in nursing homes or other settings. Medical record review when a Medicare beneficiary believes they received poor quality or substandard health care, and immediate advocacy, which is a service Livanta provides to help beneficiaries and their families when they are having problems with their care or Medicare-covered services. This month's episode is themed around heart health, as February has marked American Heart Month. To begin, we're going to share a case study of Livanta's services in action, and then move into a conversation with Dr. Matthew Stoffren, the medical director here at Livanta. The true-to-life story you are about to hear is based on stories of Medicare patients, families, and caregivers. The services that we provide at Livanta help to resolve barriers to care, inspiring hope and confidence that those in need can successfully navigate their care. Any resemblance to persons living or deceased is coincidental unless otherwise stated.
A couple of months ago, my mom was over at my house for dinner with the family. As we were sitting in the family room visiting after dinner, she began to complain of tightness and pain in her chest and arms, and began having trouble catching her breath. I held her, trying not to let the fear show on my face as my husband called 911. I was very worried that mom was having a heart attack. The paramedics arrived and whisked mom away to the hospital. My husband and I followed as closely behind as we could. Mom was seen immediately in the emergency department, where they confirmed she had had a heart attack. We sat in the waiting room while mom underwent open heart surgery because there was a significant blockage. I was so scared. Thankfully, mom's surgery went well. After a couple of days in the cardiac care unit, mom began having complications due to diabetes and kidney disease. Mom's recovery in the hospital took much longer than anyone anticipated. She had been in the hospital for nearly a month when a member of the hospital staff mentioned she would likely be leaving soon. I was glad that she was going to be discharged from the hospital, but what did that mean? Was she going directly home? Was she going to a different facility for rehabilitation? She was very weak from being in the hospital for so long, and I did not feel like she was ready to be at home on her own. My husband and I both worked full time and could help her some, but I did not know if we could provide enough help for her. After a heart attack that required major surgery, After a heart attack that required major surgery, I knew there had to be some sort of plan for her care after she left the hospital. I was at a loss and didn't know what to do. I tried contacting the office that handled discharge planning at the hospital, but I didn't get a return phone call or email. I stopped by the office a couple of times while I was at the hospital visiting mom, but no one was in the office at the time. When I asked one of mom's nurses, she said a social worker would talk to me. I was getting really frustrated at this point. I needed to know what to plan for and figure out if I would even be able to help her. I told a coworker about what was going on, and she told me that there was an advocate that helped her when her husband was in the hospital. She said the advocate contacted the hospital for her and helped get a resolution to the problems they were having. That sounded like exactly what I needed. She gave me the phone number and I called immediately. After explaining my concerns, the Livanta advocate described the advocacy process and that if I consented, he could call the hospital for me. I couldn't agree fast enough. I needed help. The following day, a social worker from the hospital called me. She explained that mom was expected to be discharged soon and discussed the care plan, which included rehabilitation at a nursing facility. That was such a huge relief for me. The Levanta advocate called later that day to follow up with me and make sure my concerns had been addressed. Yes, I now knew the next steps for mom's care, and calling Levanta made it so simple to get the answers I needed.
I'm excited to introduce to you Dr. Stoffren, who we will be speaking with today. Dr. Matthew Stoffren is the medical director of the Livanta Beneficiary and Family Centered Care Quality Improvement Organization. He is a graduate of the Johns Hopkins University School of Medicine and is board certified in emergency medicine and internal medicine. In addition to maintaining his clinical practice, his healthcare experience includes roles in emergency department administration, quality improvement, and resident education. Why is heart health an important concern for older Americans?
Yeah, so heart health is a huge topic because it refers to a lot of different potential disorders of the cardiovascular system, which includes not just the heart itself, but the blood vessels that carry blood throughout the body. The most common type of heart disease that we normally think of is what we call sort of atherosclerotic cardiovascular disease. And that's when cholesterol rich plaques build up in the wall of blood vessels and get progressively narrower and make it harder for blood to flow through those areas. And that makes it harder and harder for adequate blood flow to deliver oxygen to vital organs. And oxygen is needed for metabolism and to use energy and things like that. So the heart is basically just a pump. It moves blood with lots of oxygen throughout the body to deliver that oxygen to the organs. And then the blood returns to the heart, and then the heart sends the blood to the lungs to pick up more oxygen. So obviously, it's pretty important. We can't live without a heart because our body depends on that oxygen to maintain life. But the heart, because it is a pump and it's a muscular structure, it needs its own oxygen supply to work and to use energy. And it doesn't take that oxygen out of the blood that it pumps. Rather, some of the blood that it pumps out comes back and supplies the heart with oxygen through the arteries around the heart, which are called the coronary arteries. And those are used to deliver oxygen to the heart pump muscles. And just like any other artery, they are susceptible to atherosclerotic disease and narrowing. So, in addition to the slow narrowing over time that I mentioned, sometimes those plaques that have a lot of cholesterol in them can rupture and cause a sudden blockage. And that really leads to the worst manifestations of heart disease. One is myocardial infarction. That's what we typically would call a heart attack colloquially. And that really is just permanent damage to the heart as a result of a lack of oxygen. And sometimes heart attacks can lead to an abnormal heart rhythm that can be life threatening or cause sudden death. Another common manifestation of heart disease is strokes, which is basically the corollary in the brain. It's sudden permanent damage to a part of the brain due to a lack of oxygen. So these are very common and very disabling and potentially fatal conditions. And that's why heart health is such an important topic, particularly for older Americans, because, like with many medical problems, the risk for heart disease increases with age. And it's important to note that heart disease is the leading cause of death, not just in the United States, but worldwide as well. So, and then another important reason to consider this, especially during this month, is that there's actually a lot we can do to lower our risk of heart disease. And I'm sure we'll talk about that in a little bit.
Absolutely, Dr. Stoffren. So, one thing that's really important to know about heart disease and heart health in general is that it's a universal issue. It's something that we all have to be conscious of and be aware of. Could you speak a little bit to the how, say that one more time. Could you speak to how heart health can affect women specifically and symptoms that may show up differently between men and women?
It's interesting because women have high levels of estrogen in their body prior to menopause. And we know that estrogen has a heart protective effect. So, on average, the signs of heart disease tend to show up earlier in men and later in women. As a result, there's sort of a tendency to think of heart disease more in the context of men's health than women's health. But that's really a fallacy because heart disease is still the leading cause of death for women as well as for men. You also mentioned sort of different symptoms in men versus women. And it is important to recognize that sort of, when I went to medical school, the traditional teaching of the signs of a heart attack or something like a heart attack called angina, which is a temporary decreased oxygen supply to the heart that does not result in permanent damage like a heart attack. But the symptoms of that are pretty similar. And the symptoms that are classically taught for those are the ones that are more often experienced by men. So thinking like chest squeezing that radiates to the jaw or to the shoulder or to of the neck, nausea, sweating, trouble breathing. There's often exertional component to it. So symptoms of angina, for instance, might occur when someone walks upstairs and then it might go away with rest. And so men are more likely to experience those sort of classic symptoms, and women can absolutely have those too, and they do, but they're also more likely than men to experience angina somewhat differently. For instance, the predominant symptom might be nausea, or it might be trouble breathing without any chest pain or discomfort. Sometimes women might experience fatigue as the main symptom of a heart attack or angina, or even abdominal pain. There's also different triggers for women sometimes. For instance, women are more prone to experience angina as a result of mental distress. And there's actually kind of a rare phenomenon called Takotsubo cardiomyopathy. Takotsubo is a Japanese word. This condition is colloquially known as broken heart syndrome because it's thought to be associated in many cases with severe psychological trauma or mental distress, even though the real cause of it isn't known. But we know that women are more likely to experience it. And this condition is really something that, for all intents and purposes, looks like a heart attack. It's sudden, severe damage to the heart muscle, but there's no lack of oxygen like there would be in classic heart disease, and is also often temporary rather than permanent. And that's a different way that women might experience heart disease than men. And also, women are more likely to experience autoimmune diseases than men. And autoimmune diseases are diseases like rheumatoid arthritis or lupus, where the immune system recognizes one's own body as foreign inappropriately and causes increased levels of inflammation in the body. And we know that increased levels of inflammation accelerate atherosclerosis too. So there's a lot of different symptoms and triggers that women might experience more often than men. And that's why it's really a critically important topic for both men and women. We just need to recognize that, like with many health problems, heart disease can present differently in different people and can present with symptoms across an entire spectrum.
Absolutely, Dr. Stoffren. Um, Going deeper into heart-related disorders, what other health problems can have adverse effects on your heart health, or when you experience something called a comorbidity, where you experience two health conditions at the same time? Could you speak a little bit to that?
Absolutely. Yeah. And we know a lot about this, and there's a lot of health problems that can adversely affect the heart. So I'll mention a couple of them here. One of the biggest that comes to mind is obesity or overweight, basically just an increased amount of body fat. And the reason why this is so important is because not only does being overweight or obese increase the risk of heart disease itself, because it makes the heart work harder and increases the stress on the heart, but overweight and obesity also increase the risk of many of the other conditions that also lead to heart disease. So it's kind of, a double harm. Also, of course, obesity and overweight are very prevalent in our society. As we know, we have a high availability of calorie-rich food. We don't move as much as our ancestors did. There's a lot more sedentary lifestyle. And once somebody is overweight, the body adjusts its metabolism to try to hold on to weight. It's sort of an adaptation that our ancestors had, back when food was scarce. And unfortunately, that really nowadays makes it very difficult to lose weight once someone is overweight. Of course, there is treatment available. I mean, certainly lifestyle modifications like healthy diet, increased exercise, those kinds of things. And of course, our listeners probably know that there's a lot of new medications for obesity, like the GLP-1 agonists. There's also very effective surgery for severe obesity, like the gastric sleeve. So there's certainly things that can be done about overweight and obesity, but that is a big risk factor that increases the risk for heart disease. A couple other conditions. So one being like hypertension or high blood pressure. We often think of that as sort of the quote unquote silent killer because most of the time high blood pressure causes no symptoms at all and people don't even realize that they have high blood pressure. But knowing that someone has high blood pressure and treating it is very important because that increased pressure in the cardiovascular system will damage arteries over time, and that accelerates that atherosclerosis, those cholesterol plaques that I was talking about. And then, of course, that leads to heart disease and strokes. The increased pressure also causes extra stress on the heart. And over time, if the heart is working harder than it should be, that will start impairing its function and lead to heart disease. Um, as well, hypertension can be treated with lifestyle modifications, weight loss, exercise, low salt diet. And of course, there's lots of medications that can be used. And people often question the need to use high blood pressure medications. But again, it's really important to treat this as a modifiable risk factor. It's one of the very most common risk factors for heart disease. And it's important to note also that controlling blood pressure has life benefits even very late in life, too. It's always beneficial to control the blood pressure. So that's an important one. We've been talking about cholesterol in the setting of atherosclerosis. And so high cholesterol, of course, is also another risk factor, particularly high levels of bad cholesterol or LDL cholesterol can accelerate heart disease. And like high blood pressure, high cholesterol usually does not cause any symptoms on its own, but it's still important to have those levels checked regularly as part of regular preventative health care. And high cholesterol can be treated with diet and medications like these other conditions. The other condition I want to mention is diabetes, and that's a huge one. Diabetes is really when the body has difficulty controlling blood sugar levels using insulin. And insulin is a hormone that's made in the pancreas, which is an abdominal organ. And there's different types of diabetes, and all of them increase the risk of heart disease. But the most common type of diabetes, and the one that we most often think of in older adults, is type 2 diabetes. That's when the insulin that the body produces really doesn't work as well as it should to control blood sugar levels. And just like high blood pressure or high cholesterol, having a high level of blood sugar in the blood will over time cause damage to blood vessels and accelerate that atherosclerotic narrowing that I was talking about. And diabetes is extra important too because it damages other essential organs like the kidneys, like the eyes, the nervous system. And so it's very, very important if someone is diagnosed with diabetes to try to control those blood sugar levels through diet and exercise. Sometimes that's all that's needed in mild cases, but usually medications are required. Many are effective and available. And severe diabetes, sometimes people have to take insulin as well, although there's more and more options that spare people from insulin. But again, very, very important condition to diagnose and to treat to prevent heart disease. And then lastly, I should mention cigarette smoking too, which is a huge preventable risk factor. We know that people who smoke a pack a day of cigarettes have 3 to 6 times the risk of a heart attack compared to people who don't smoke or never smoke. And that's because the chemicals that are in cigarettes directly damage the blood vessels. They increase inflammation. Like I talked about, inflammation itself is a risk factor for heart disease. Cigarettes increase the heart rate, which makes the heart work harder. And believe it or not, cigarettes also contain carbon monoxide. And we know that carbon monoxide is toxic to our bodies because it makes it harder for the oxygen in our blood to actually get delivered to the organs that need it. And unfortunately, cigarettes and the nicotine in cigarettes are very addictive. And so it's very hard for people to quit, even when they know that cigarette smoking is harmful to them. But just like all of these other conditions, treatment is available, nicotine replacement. There's actually medications that help people quit. And it's never too late to quit smoking. The increased risk of heart disease that people get from smoking actually decreases surprisingly quickly after people stop smoking, and those benefits continue the longer people abstain. So that's another important risk factor to mention.
So, Dr. Stoffern, you mentioned a couple of different ways to improve personal health there related to heart health. Could you speak a little bit more to how your level of physical activity can affect your heart health, and if there are any other ways to support your heart health as you age?
Absolutely. Physical activity is hugely important for maintaining heart health at all ages. I mentioned with the risk factors that I just talked about, most of them, the treatment involves lifestyle modification, which involves increasing physical activity. Exercise helps to manage obesity and overweight and reduces the risk of the things that I mentioned, like high cholesterol, high blood pressure, diabetes. And exercise also has direct beneficial effects on the heart itself. When we exercise, it initiates adaptive mechanisms in the body that help the heart and the cardiovascular system work more efficiently so that you can do more work with less effort. And that helps to spare the heart and to spare the risk of heart disease. And of course, exercise also has other positive effects, like on mental health, which can only help with one's overall well-being, which is never a bad thing. So there's so many reasons to increase physical activity at all ages. And it really doesn't have to be very much. Even we know from studies that as little as 1 hour of exercise a week can be beneficial. So just it doesn't have to be strenuous. Just going for a walk a couple of times a week can have definite physiologic benefits. Of course, many experts recommend more. Some common numbers that are floated out there include about 30 minutes a day of exercise or 2.5 hours per week of moderate intensity exercise. So, trying to break a sweat. But importantly, if someone knows that they have heart disease, or they get really out of breath whenever they climb steps or things like that, it is important to approach exercise in a gradual fashion, and not just go from complete sedentary lifestyle to a moderate exercise right away. It's important to touch base with one's primary care provider or cardiologist. Exercise is important for even people with heart disease, definitely, but it's a good idea to touch base with one's primary care doctor first or a cardiologist to make sure that you go about it in a gradual fashion and go about it safely.
Bringing things back to the work that we do here at Livanta, how can the QIO services help in situations surrounding heart health?
Yeah, absolutely. So, we've been talking about how important heart disease is and how prevalent it is. And so it's not surprising that heart health is a major reason why Medicare beneficiaries access healthcare or are admitted to the hospital. And so Livanta provides multiple free services to beneficiaries who are either currently receiving healthcare or recently received care. And I can maybe go through a couple of examples. So, for instance, if someone's admitted to the hospital because they had a heart attack or they had an exacerbation of congestive heart failure, and their attending physician says they're now ready to be discharged, but they don't feel that they're ready, they have the right to appeal that decision to the BFCC-QIO, and that is Livanta in 27 US states and territories. What we do in those cases is we request the medical records from the hospital, we review them, and then if we agree that the medical records do not support that the beneficiary is ready to be discharged, then the hospital must continue to care for that beneficiary until they determine again that the beneficiary is ready for discharge, at which point the beneficiary can then appeal again if they feel that they're still not ready. So that's an important protective mechanism that we offer. And appeal rights also apply to post acute services. So, post acute means after the hospital. Those examples might be if someone is sent to a skilled nursing facility and then the skilled nursing facility is terminating services, or if they're sent home with home health services. Obviously, people with heart conditions may have difficulty leaving the home. And so, when they're discharged from the hospital, they may be prescribed home health services. For instance, if someone has congestive heart failure, maybe a nurse is coming out a couple times a week to monitor their vital signs, go through their medications, monitor their weight to make sure they're not retaining too much water. They may also have physical and occupational therapists coming out to the home to provide rehabilitation and to teach them rehabilitative exercises to improve their level of function. And if the home health agency or a Medicare Advantage insurance plan determines that those services are no longer needed or can be obtained in a different setting and terminates the home health services, then that beneficiary can also appeal that decision to the QIO. And if we agree with the beneficiary after looking at the medical records, then the home health agency must continue to provide those services until they make a new determination that those services are no longer medically necessary. So, again, sort of a protective mechanism for Medicare beneficiaries. And then another service that we offer is sort of retrospective in nature. So, for instance, if a patient with a heart problem feels that they received inappropriate or unsafe care, and it's not related to something that is an appeal, like a discharge or termination of services. An example might be if they feel that their doctor didn't treat their blood pressure appropriately, and as a result, they had a stroke or something like that. They can report that concern to us. We talk with them to understand the concern in greater detail, and then we request the medical records related to that concern, and we determine if the standard of care was met. And if it was not met, what we do is we engage in a collaborative discussion with that provider. We work with them to figure out what caused the inappropriate or unsafe care, and we work with them to address the root causes of that. And so that helps prevent similar symptoms from happening, or excuse me, similar problems happening to future patients, and improving care for everyone moving forward.
Thank you for going through some of our QIO services, Dr. Stoffren. One other question related to the QIO services. Caregivers also play a huge role for folks with various cardiac conditions. How can caregivers utilize the services as they support their loved ones?
Yeah, that's a really good point, actually, because a lot of the times the people who reach out to Livanta with concerns are not necessarily the beneficiary themselves, but someone who represents the beneficiary. So commonly a family member. Family members are often in the position of being caregivers themselves because they're providing essential care to the Medicare beneficiaries. And it's important to recognize also that caregiving doesn't necessarily mean like hands-on care, although it certainly can be. It can include other things that are as simple as helping with chores around the house or driving someone to and from doctor's appointments, sorting medicines into a pillbox for beneficiaries. All of those things are really care and caregiving. Even asking questions of medical providers, for instance, it's often the case that a family member is sort of the main liaison for beneficiaries between them and their medical providers. So it's really common for caregivers and family members to feel like they are not getting the information they need from a beneficiary's healthcare providers in order to provide the needed care for their loved ones. And we can often help in those situations through our immediate advocacy services. An example of when someone might reach out to us for that might be if a beneficiary or their family member has called a doctor's office with questions about a new medication for their cholesterol, for instance, and they're not getting a call back. Or maybe they have home health services and they were expecting a nurse to come today to check vital signs and check weights, but the nurse hasn't shown up. And so when beneficiaries or the representatives are running into roadblocks like that, they can call us for immediate advocacy. And what we do is we have advocates that reach out to the healthcare providers on the beneficiary's behalf, really in order to get answers to their questions, ensure that they're getting the services they need. And really, we want to fix those concerns in real time in order to avoid the potential harm that can happen as a result of inadequate care. And in this way, we really want to provide that service for beneficiaries and caregivers so that they can be assured that they have a free of charge service to utilize whenever they feel stuck or aren't getting adequate answers for their questions.
Thank you so much for your time today, Dr. Stoffren, and guiding us through some really important information about heart health and the QIO services here at Livanta. I wanted to give you one more opportunity if you have anything else to share about either of those topics.
Yeah, sure. Thanks for having me again, Noah. Really, what I would say is, this is a really important topic. It's very timely with Heart Health Month to go through heart disease and ways to prevent it and why it's important for older Americans and how we at Livanta can help. But in addition to the services that I just mentioned, we of course have a mission to educate, much like this podcast is doing. And so I also wanted to mention that we publish a number of publications like the Livanta Compass that have a mission to educate providers and Medicare beneficiaries. And it provides general education on medical topics like heart disease and other topics that are interests to Medicare beneficiaries. I want to mention that this month, also being Black History Month, there was a very nice series on healthcare pioneers who are African American. And it's a really nice publication that people can sign up for on our website. So I would encourage our listeners to do that as well.
For more information about Livanta, including where to sign up for a monthly publication, the Livanta Compass, and to find your state or territory's helpline number, visit our website at www.livantaqio.cms.gov. That's LIVANTAQIO.cms.gov.